As we get older, injuries and ailments become more common, especially for women, but UConn Health can help. Take a look. Let's talk about some of the common orthopedic issues that women face and why it might be different from men.
Yeah, you know, women, we have different anatomic and hormonal factors that play into injuries and sort of orthopedic conditions in particular. So things like ACL tears, women are nearly 8 times as likely to tear their ACL than a male counterpart. Patellofemoral pain syndrome, arthritis, things like stress fractures, concussions, all things that are more prevalent in females and we see in our female patients. So the Women's Center of Motion Performance is super exciting here at UConn. It's a new initiative, and it's basically a multidisciplinary collaborative approach of providers that want to take better care of women patients. And you know, like we mentioned, that women have sort of unique needs, but also have desires to stay active. So this is a center that we treat young athletes that, you know, keep them on the field and when they get injured, but also all the way up to older females that just want to continue to be active with aches and pains and need somebody to take care of them. And the center sort of combines orthopedics, sports medicine, non-operative orthopedics, foot and ankle surgery, total joints. And then we also have, outside of orthopedics, and this is where the multidisciplinary team comes into play, we have physical therapy, we have psychology, we have bone health, we have internal medicine and lifestyle medicine, so patients that may need some weight loss as they continue to be active, to be able to stay active. So it's really exciting for us.
Are there any other benefits for women from this center that you want to make sure you highlight?
Well, it's a lot of female providers, and I think we have a unique perspective. Only about 7% of orthopedic surgeons are women, so it's hard to find a female orthopedic surgeon. So if somebody's looking for that, to understand sort of some of the unique needs, you know, we have 3 amazing female orthopedic surgeons here, and we also have a ton of male counterparts that have a lot of experience treating women. And I think understanding the differences with men and women and how injuries occur and how they rehab is very important, and it sort of goes into our personal approach. And it's not about just the athlete, it's about your own personal goal, identifying that and helping you achieve that.
Is this kind of center unique in terms of the care that you're providing?
It is unique. There are some other centers in the United States, none in New England, and we definitely want to be a regional center of excellence. And we, you know, have not only the sort of faculty and physicians, we also have the reputation in regards to being able to take care of some of the world-class athletes at UConn. And that's really exciting that we are able to take what we know and what we use with those world-class athletes and really apply it to all the patients we treat here.
Is there a patient story in particular that is like memorable to you in terms of like the impact that the center had on their quality of life?
Yeah, I think it's one that doesn't just come to me as a surgeon that needs an ACL tear. I see those, you know, too often. I wish they didn't happen, but it's more of the patient that's a little bit more complex, and it's the sort of non-traditional athlete. You know, it's the mother with young kids that want to be active, but now all of a sudden their hip hurts, and you know, maybe they desire to have some weight loss as well. So we have a nurse navigator to help that patient see them through this journey and help with getting into physical therapy, seeing a non-operative sports medicine surgeon, potentially having an injection, you know, getting some relief, but say they don't have, you know, all the relief and they continue to have pain, and then, you know, somebody help facilitating ordering that MRI, getting that MRI scheduled, and then maybe they do need surgery, and then we can rehab them and get them back to being active with their kids. I'm a surgeon, and, you know, obviously I love to operate, but a majority of our people we see don't have surgical problems, which is good for the patient. But I think understanding that, you know, we have a whole non-operative approach as well, and make sure that, you know, patients are able to have access to physical therapy and non-operative surgeons, injections, and things that can sort of help their symptoms without necessarily needing surgery. But we're also here for their surgical needs when they need that as well.